Nache, the Northern Regional Minister or his representative, Director General, Ghana Health Service, Deans of the School of Medical Nursing, and midwife leaders and management is as timely as it is significant. The recent history of our nation and the world has shown us that the health emergencies do not announce themselves when they strike. They test not only the strength of our infrastructure, but also the courage and resilience of our professionals. At every point, from the COVID-19 pandemic to outbreaks of cholera, meningitis, and mpox, it is you, the nurses and midwives of Ghana, who have stood firm, serving as the backbone of the national response. For this, your country is deeply indebted to you. Distinguished guests, ladies and gentlemen, the vision of government under the leadership of His Excellency John Dramani Mahama is clear: to build a Ghana where every citizen, irrespective of background or location, can access healthcare that is equitable, affordable, and of the highest quality. Achieving this vision requires not only hospitals, medicines, and technology, but above all, a motivated and well-supported workforce, especially our nurses and midwives, who remain the frontline defenders of public health. It is for this reason that we have introduced bold and targeted reforms to widen access to training and encourage more young Ghanaians to pursue careers in nursing and midwifery. The cost of admission form for Health Training Institute has been reduced from 200 cedis to 150, a 25% reduction. In addition, under the no-fee stress policy, admission and tuition fee for all first-year students of nursing, midwifery, and allied health programs in public institutions has been cut by 50% for the 2025-2026 academic year. These measures are not merely financial interventions, they are deliberate steps to ensure that no deserving Ghanaian is denied the opportunity to serve because of financial constraints. Beyond access, we are raising the standards of training. The transition of nursing and midwifery training colleges into degree awarding institutions is a transformational step. The reform will enhance the quality of instruction, align training with international best practices, and empower our nurses and midwives' competencies befitting the demand of a modern healthcare system. At the same time, government recognizes the increasing global demand for Ghana health professionals. So we celebrate this international recognition. We must also safeguard our national needs. A managed migration policy is therefore being developed to balance the professional aspirations of our nurses and midwives with the urgent requirement to sustain adequate human resources for health at home. Our goal is to achieve a win-win outcome, one where Ghana contributes skilled professionals to the world while retaining the critical numbers required to secure the health of our own people. Ladies and gentlemen, a strong workforce requires the right tools. The Ministry of Health is intensifying effort to equip health facilities with modern equipment and essential supplies so that you can work with confidence and efficiency, particularly during emergencies when speed and effectiveness makes the difference between life and death. But I must emphasize, no matter how robust our policies, no matter how substantial our investment, the success of our reforms ultimately depends on you. You are the trusted link between government and the people. You are the interpreters of policy, the conveyors of truth, the visible expression of care in the community we serve. I urge you, therefore, to take ownership of these initiatives, to be champions of their benefits, and to embody the values of excellence, compassion, and integrity in your leadership. Now, Chairman, allow me to commend the Nurses and Midwifery Directorate for the foresight in bringing this year's conference to the Northern region for the very first time. Your decision reflects a commitment to inclusivity and to strengthening healthcare leadership across the entire country. On Friday, we shall celebrate the 5th Excellence Award, a platform that honors the best amongst us. I extend my warm congratulations to all nominees whose dedication, innovation, and excellence set an example for us all. As we conclude this gathering, I look forward keenly to the communique that will emerge. The ministry will study your recommendations carefully and integrate them into policy and practice. Together, we shall continue to build a health system that is resilient in the face of emergencies, equitable in its reach, and compassionate in its service. Distinguished ladies and gentlemen, let us move forward with renewed resolve. Let us work together to ensure that every Ghanaian, wherever they live, can enjoy the blessings of good health, supported by a strong and dignified nursing and midwifery profession. I thank you for your attention. May God bless our nurses and midwives, and may He bless our beloved homeland, Ghana. Thank you.